members and good evening, everyone, respected jury members and my co-participants. I have my experience of managing the COVID crisis. We know it was a global crisis, but I present my Jammu model, specifically focused on sustained diagnostic and therapeutic outreach towards general population, irrespective of limited resources. So these are my responsibilities, variegated. I am a principal investigator and nodal officer, viral research and diagnostic lab under ICMR, Directorate General of Health Services, DHR, since 2014. 2018, I was assigned the duties of heading of Department of Microbiology, and I was found the principal GMC Kathua, one of the new medical colleges. But his VRDL experiences had empowered and given me some miniature expertise in civil amendments, establishments involving the mechanical and electrical components, procurements, equipment, specifications wise and consumables, recruitments, all those experiences. So that is my, before 2014, I was a teacher and a laboratorian only. So 2018, my implementive and administrative career has begun. I am principal GMC Jammu, which is having its golden jubilee year, and deep medical colleges, dental colleges, and 2 Ayurvedic colleges also. So this is an integrative kind of experience where modern and traditional medicine, primary, secondary, and tertiary healthcare, and medics, paramedics, and nursing excellence, and for the last 2 months, I have additional charge of another new medical college in Rajouri, and nodal officer I am for Udhampur Medical College, which is to be established this year. So these kind of job responsibilities have given me an insight and innovations every moment almost, because it is a dynamic kind of evolving system. Everyday customization and practicing new methodologies. From the point of view of testing as a laboratorian, tracking was the administration's part, but treating the patient and then the public health responsibility, working for the overall pandemic control. So I have some experiences to share. Rich tributes to late Professor U.C. Chaturvedi. He had foreseen the emergence of such pandemics in way back, a decade back, more than a decade back, because disturbed ecological balance and even the micro disturbance, the entire antibiotic overuse and pesticides. So the microbiologically also the balance is overall deranged. He had foreseen the emergence and re-emergence of some novel agents like the one emerged in 2019 and in December 2019. And also he had foreseen the natural and man-made, biogenetically engineered biological warfare. And that was the purpose of establishing viral research and diagnostic labs. And we were one of them. And we were the level 3 lab, actually, the lowest, most medical college level. He foresaw, or he proposed establishment of 8 regional labs, some state level labs, and then some medical college level labs. So that is how we got begun, and that is how we were prepared. But the dictum is, when it is a pandemic, above all the things is love and compassion, which binds everything together in perfect harmony. So my experience...
Ma'am, could you please move your slides also? The slides are not moving.
Not moving?
Yes, ma'am.
Is it moving now?
Yes, ma'am. Now it's moving on.
So there were no timelines when it's a pandemic. We had to be abreast or ahead of the viral activity. Hurdles were many. We were caught unaware. Objectives were patient care, disease containment, pandemic control, public health. Innovations, like it was all innovations. So everything was new. It was every step was an innovation, and policies and protocols, like ever evolving policies and protocols. Outcomes were heartening, and we have established future plans now. So recapitulating history, it is ending December 2019, we began with this threat. 27th of January, we had the first case in India in Kerala. 30th of January, it was declared a public health emergency of international concern. 18th of February, I was appointed a co-consultant with a scientist, Dr. Neeraj Agarwal from ICMR, to establish another lab in Jammu region in Command Hospital, Udhampur. 5th of March, we received directions like we have to start testing for COVID. And 8th of March, we did our blind testing and quality checks and dummy runs. And 9th, we started our testing with 5 samples. And 11th of March, the pandemic was declared also by WHO. So we start, despite all, nothing on the ground, I'll share all my constraints. BRDL recognized and its responsibility for its Jammu division, which is 10 districts, 53 lakh population, and terrain is from plains to difficult vast Pir Panjal range. We knew we would expect samples and patients from these inaccessible areas. There was absolute non-availability. We were insufficient in terms of infrastructure, equipment, trained human resource, consumables, reagents, everything was insufficient. And we made a beginning only with 5 trained human resource, including me, and 1 was deputed from the health department. Only 5 were trained for testing, but augmentation had to be done with long working hours. These 3 years, we have been 18 hours by 7, all 7 days, and there has not been a break. So the entire team has worked without a break, no morning wait, night duties. So this was what was available with us, scattered laboratory setup. That was already biosafety compromised. That is the highlight that is to be underlined. We had a biosafety cabinet which was non-functional, and as per Neeraj Agarwal, we could not have started the testing also. But for 6 months, there was not a single lab accident or there was not a single lab acquired infection because we had some innovations. These innovations were, this was the scattered laboratory structure would mean this 130 meters long corridor, which ideally should not be so. It has to be as a 1 unit pre-PCR, then the PCR, then post-PCR. So the lab professionals had to be moving these almost 150 meters, the entire corridor, but some innovations in the form of a very cordial working environment, all smiling healthcare professionals, because challenges were, we were simultaneously training the entire healthcare professionals from all the 10 districts, even the forces, CRPF, BSF, Army Command Hospital. They were coming for infection control practices training, donning, doffing, bio-waste management, all infectious waste management, then sample collection, transportation, and storage. So the activity used to be in these corridors, and the lab professionals, the workers for testing also used to be moving across these corridors. And frequent touch areas, that is door handles, door knobs, all the surfaces were glass topped, and every hour decontamination with hypochlorite and alcohol. And that was a practice that was very religiously adopted. That is one thing we did, that was absolute innovation. And citrus fruits and lemonade to the team who was going to sort the samples and going for RNA extraction from the sample, from the VTM, the viral transport medium, the samples. So nutrition, cordial environment, and decontamination. 6 months we did not have a single lab accident or a lab acquired infection. It's only after the community transmission was established did our lab workers, they start getting infected from their homes. So this is all these ideas we had got from our trainings in NIV Pune, where small clusters and small epidemics and pandemics or some zoonotic diseases, infections, Kyasanur forest disease and Nipah viral infection experience. The teams of NIV Pune, they reach to those sites of outbreaks, and they established their laboratories there in tents. So all the practices and procedures were adopted by this laboratory, and that is how we got started. So establishment was a challenge. Augmentation, it had to be like initially we thought we'll not be able to go beyond 10 samples testing per day, but then we could reach up to 2,000 samples manually till we got automation and semi-automation, and we could reach up to 36 samples per day. And another highlight was same day reporting within 24 hours, the pre-analytical, analytical part of the testing and post-analytical, by which I mean the report would reach the clinician or the directorate or the NHM or the administrative department or DCs of all the 10 districts. So this is all that we were trying. So if the SOPs were ever dynamically evolving, there was daily customization. Despite quantity, quality was properly monitored. Initially, we were into proficiency testing checks with the national labs, NIV Pune and CDC Delhi, PGI
Sorry to
Chandra.
interrupt. We have another 2 minutes to conclude the presentation.
Okay. So the quality was checked. We were into this proficiency cross-checking with all these labs. As principal government Ayurvedic Medical College, all immunity boosters, traditional system of medicine for the healthcare professionals, hotels at a stage for the healthcare professionals where they could stay away from their the elderly and the too young, and for that is how we were moving ahead. 100% RT-PCR testing was done for all the travelers coming to UT of Jammu and Kashmir, all railway travelers, all airway travelers, and even all the road passengers. All were tested. The 10 RT-PCR labs were established. We were the resource center for them, and fast training the healthcare professionals. 10 of them could be established, and Jammu has nearly led, and we have been almost number 1 in testing per million population wise. So that is how the disease was the pandemic was well managed. We started with 125 beds COVID dedicated, and we went up to 967 in the peak second lethal Delta wave. So 967 patients were admitted at one time. That was the maximum number. Not a single patient was denied any oxygen supported bed. So cylinders were provided to the patient in their transport facilities and waiting areas also. Physiotherapy and psychotherapy were added. The entire healthcare professionals, all the staff was trained into this, and we permitted attendants to the patients, COVID infected ones, well-informed attendants who could, with no comorbidities, for emotional and psychological support, and that had an impact on the disease outcome. So that was another innovation. Number of tests has been good numbers per million population, and all this was possible because strong political will at the center and of the UT government, academia, intelligentsia, laboratorians, public health specialists, the clinicians. We were all on board, and all technical inputs were taken by the Jammu government, the UT government. 16 lakh tests have been done by VRDL GMC Jammu till now. Now we have achieved high throughput machines, many of them all automation. Govt 6800 laboratory has been established, and whole genome sequencing, 2 sequencers they are about to reach and will be self-sufficient. A chapter was contributed on human viruses, emergence and evolution in elsewhere, almost 60 pages by me, and 60 papers have been submitted on various aspects of this pandemic.
Ma'am, you can conclude now.
Yes, the work was appreciated, and on 15th of August, I received that award, Lieutenant Governor's Award. But soon we'll have an independent Department of Virology, PSL3 laboratory, and we'll have the most advanced molecular and gene-based diagnostic techniques, and we would love to participate in preparation of those, manufacturing the diagnostic kits and vaccine trials. So we have learned some lessons, the ecological balance, global warming, urbanization, forestation, that is to be re-ensure to be away from or keep the pandemics away, and rational use of antibiotics in animals and humans, and global warming we need to look into badly. And these are the things we learned finally. And yes, ICMR, DHR, under the aegis of this, we had our VRDL, NIV Pune, Government of India, University of UT Administration, JK Medical Supplies Corporation, Administration of GMC Jammu, and staff, entire staff. This has been a perfect model of cooperation, coordination, and there has not been a no from any healthcare professional. And we could do pretty well. Thank you very much.
You have done a commendable job. No questions.
Thank you, ma'am.
Ma'am, the activities and the work which you have done, it seems to be a routine activity for a health department. So,
yes, sir. Seemingly everyone has done it because it was COVID pandemic crisis, and the challenge was similar for everyone. But
yes.
sir, it was, sir, you are very right there. But I didn't have a kitchen, but I started cooking, and that is my point. And I didn't have a biosafety cabinet, and as per guidelines, I could not have started my VRDL, but with all those innovations, good working environment, and a family-like environment, for 6 months, we were progressing very fast, and there was no lab accident and no lab acquired infection. That speaks of the good lab practices and good clinical practices. So this was more of applied and mind application than of the scientifically written procedures and protocols. Everyone was on a listening and very receptive mode. Even the super specialists joined hands, and they were inside the COVID wards. And initially there were some I was put to this position when my predecessor had actually withdrew from this because challenge was too big, and coordination to get everyone on board was becoming difficult. But we actually, I don't know, God's grace or I am a follower of Paramahansa Yogananda, all love in the institution and absolute harmony and coordination. These are the highlights.
Okay, so we can call it as a good example of coordination.
It was